Have the privilege of introducing our next esteemed speaker, Dr. Kiran Kumar, HC. Sir completed his BDS in 1999 and MDS in orthodontics in 2005 from the prestigious Bapuji Dental College and Hospital, Davangere. He further pursued his MOSG from the Royal College of Surgeons, Edinburgh in 2008 and was awarded the title of Diplomate of Indian Board of Orthodontics in 2011. Currently, Sir is serving as professor and head of the Department of Orthodontics at Bapuji Dental College, Davangere. We are honored to have him with us today. Please join me in welcoming Dr. Kiran Kumar. Sir, you're muted, sir.
1 minute. No, I'm on this thing. I'm just sharing my slides.
Yes, sir. Yes.
Okay, I'm audible.
Yes, sir. Yes, sir. You're audible, sir. I can see your screen as well.
It's fine, full screen, no?
Yes, sir.
Okay. Very good morning to respected chairman, chairpersons, and dear students and the organizing committee. A very good morning and warm wishes from Davangere, Bapuji College Hospital. The Gnan, whatever is there, it's all from the blessings of Sharda Devi. So whatever I'm going to talk or whatever I'm sharing knowledge with you is all because of the blessings of This is my disclaimer that I'm a freelancer knowledge provider. I'm not interested in any of the company or an official spokesperson pertaining to any of the technique or any mechanics or such as such. So coming to my topic is theory examination phase 2, records for critical exam. Part 2 examination consists of paper 1, paper 2 and paper 3. And as much as all of you know that it's about 3 hours duration. Your paper 1 and paper 2 shall consist of 2 long answer questions carrying out 25 marks each and 5 questions carrying 10 marks each. In paper 3, 3 questions will be given and student has to answer any 2 questions. Each question carries 50 marks and questions on recent advances may be asked in any or all the 3 papers. And it is always better that you answer those questions which are well versed, because that is not the time for you to think and answer the questions during that point of time, because to frame answers for that question in those 3 hours is not an easy job. And coming to your exam point, there shall be 4 examiners in each subject. Out of them, 2 shall be external examiners and 2 shall be internal examiners. And both external examiners shall be from a university other than affiliating university, and 1 examiner shall be from a university of different state. Coming to your paper 1, paper 2, part 1, the topics that includes any of the standard university or according to the DCA guidelines consist of orthodontic history, concepts of occlusion aesthetics, child and adult psychology, intelligent classification, malocclusion, dental-facial anomalies, diagnostic procedures and treatment planning in orthodontics, practice management in orthodontics. Paper 2 more of relies on the clinical orthodontics and paper 3 more on descriptive and analyzing type questions. So what is the scope and the topics in the paper 2 consist of advanced orthodontics and clinical techniques. It involves growth and development and its clinical applications in relation to craniofacial growth theories, biomechanics and orthodontics with force systems and anchorage control, diagnosis and treatment planning for malocclusion in all 3 conditions, angles class 1, class 2, class 3, management of dentofacial deformities, diagnosis and management of skeletal discrepancies, orthodontic appliances, which includes removal, fixed, functional, hybrid, and current perspectives of orthodontic appliances, newer orthodontic appliances, orthodontic surgery and principles, interdisciplinary management, multidisciplinary management, complications and risk management. Paper 3 consists of recent advances, evidence-based practice, and case analysis, with more emphasis on recent innovations, the temporary anchorage devices, clear anemotherapy, digital workflow, and 3D simulation, self-segregating brackets, customization of appliance, 3D imaging, and AI-based diagnosis and treatment planning. Now, coming to preparation start, that is what we have in our university or as per the BCA guidelines. Since our department is our college is affiliated to Rajiv Gandhi University, so what as a student, if you can take, I'm going to write an exam. So how I should prepare? So I have to map my preparation to RGT syllabus. So there'll be a curriculum book which will be given to most of the students, and what happens is we just take it and keep it in some place. You have to go through that curriculum book, okay? Because you have to allocate sufficient revision time per topic. Most of the times we have read, but we don't revise, and we don't apply in our day-to-day practice. And the most important thing is the most of the examiners who are going to set the question papers, there will be university guidelines. So the university guidelines consist of those topics which the university has published in their curriculum book. So we don't go to the curriculum book and we read for something and we miss certain parts. So it's always better that you revise your curriculum. Then review your past question papers for recurring themes. Practice writing very concise and structured essays. Previously, our orators have spoken about incorporation of diagrams, including force vectors, appliance designs, and read recent journal articles and to cite key persons in the respective field to be added when you write your answers and highlight them so that you know the current perspective or the current literature. Now, when it comes to exam, the problem with us is we don't distribute our time. We know one question very nice, so we start writing on the paper. Then at the end, we forget to answer two questions. So in your paper one of paper two, you have to answer two main questions and five short notes. You spent a lot amount of time in answering the two main questions, and you have to leave two short notes. So you have left two short notes. Two short notes means that means you have answered your exam only for 80 marks. You have not answered your exam for 100 marks. So out of 80 marks, however good you have written, you're not going to get out. You're not going to get 25 out of 25 because there are certain limitations. There are certain things which are there because the max distribution, evaluation criteria, based on that, out of 25, you might get 20. So 20 plus 20, 40. Out of 30, you may get other 15. So again, you are at the verge only 50 or 51, 52 marks. That means there are high chances that you can be within 50. So it's always better that you attempt your questions. Dear students, make sure that you divide your time. And after that, you should not stick to that answer. Immediately, you have to shift to the next question so that you can proceed your answering the question. Now coming to answer writing tips, a detailed, well-textured content list. This is very well covered by the orators. In the brief, even I'm also going to speak about it. You need to have a body, introduction, heading and diagrams, conclusion references. Label all figures clearly, even simple schematic scores. Use table for comparison. For example, sometimes a question might come stats versus conventional anchorage. So during that time, you can use a comparison. Link clinical examples to theoretical concepts. For paper 3, briefly reference landmark studies or recent consensus. When you write your exam, organize your thoughts, use clear headings or diagrams where appropriate, and avoid unnecessary complexity. Sometimes what happens, you start answering the paper, then you find out that that is not relevant, and you try to scratch it down or do something else. That is an indication that the examiners will immediately come to know that, okay, this student, probably you written the answer very well, but the impression is not so good. So a well-structured, straightforward response makes it easier for examiners to follow your reasoning and award full credit of marks. You have to have a balanced time management and subtle, simple presentation together create a strong impression and maximize your performance. In a given 50-page prescribed limit for MDS theory papers, judicious management of content and space is imperative. You can't tell that the paper is not enough for me to write an answer. It is all about how you concise a elaborate topic or A concise topic, how you can make it more elaborative. That is the skill of the student. That is the skill of the student. So candidates must allocate pages thoughtfully, ensuring that no single answer consumes disproportionate space and time at the expense of other questions. Now, for example, we have a question here: define alloys, classify alloys used in dentistry. So this is the content list of that particular short answer. Following that, there's an introduction, there's a body and headings. So there's a description of industry, alloys, manufacturing, classification, solid solution, phases, properties, commonly asked, alloy strengthening mechanism, conclusion, references. Following that, he or she starts answering the paper, and it flows in this way. As we proceed, the answer still continues where there's a description about classification, following classification, solid state solutions, solid solution, and it is very clear, it is very mentioned, and he has highlighted in certain areas where it has to be done. Okay, following that, we proceed further. The answer gets continued still more further. There is a schematic diagrammatic representation of the property, I mean, of the different types of alloys based on their solid liquid composition and a diagrammatic representation of solidification of the alloys. Following that, we have different types of alloys, strengthening methods, coming to conclusion, and the references. So in our department, we have a session called basic topic session or basic topic seminar. In a basic topic session, what happens? We give a particular topic, and the student prepares and comes. And this is one such topic which was prepared, and this is how the student writes and submits for evaluation, which we go through it. And like this, the topics are made, and they have some amount of good amount of answer scripts, which is meant for there to prepare for the main exams. Now, and we conducted test on particular topic. So the question was basic properties of orthodontic wires. So we have two candidates here. We have two candidates here, candidate one and candidate two. I'm just briefing you how a teacher when they go for evaluation, because when they read a good answer, what happens the next thing is they will try to remember that answer was very well. So they might start comparing your answer to a previous answer script or a previous answer or something which is there in their memory. So when that is a scenario, so you need to make it more to say you have to make your answer more attractive. To make it more attractive, so we have candidate one and candidate two. So the question is basic properties of orthodontic wires. The candidate one has written the contents of basic properties of orthodontic wires with introduction, force, types of stress, limits, strength, resilience, all the basic properties. Here also the handwriting is quite good, but here what happens? You straight away started answering the question. Straight away answer the question. Now as we proceed further, next there's a properties of prey strain. This is fine. Even there's a diagrammatic representation. The answer is very legible, very legible. Don't try to fit answer in answer, like making small boxes in the answer paper and that small box one more box, because the scan thing, if it's not scanned properly, we can't read it. Sometimes we can't read it. Okay, then as we proceed further, this is the description about tensile stress by the candidate one and a comparative evaluation of the properties by candidate two, and we come to the end of the answer paper. Now, when we start dividing the marks, so this is a short notes. So for 10 marks, so 10 marks. So whenever as a teacher, how, for example, how I would have proceeded on evaluation is, so out of 10 I always keep 5. So that means the student is in the pass mode only. So 5 marks has been kept. Now as I go through the answer, if the students has added points, we add point 0.5, point 0.5, point 0.5, point 0.5, point 0.5. So that what happens is, and he is scoring the marks. So definitely from 5, SD to 7, 7.5, 8, 8.5, that's fine. Sometimes the student has written the answer in only one page. So how do you say that you will have to get 3 to 4 marks? They just written 1 or 2 pages. And very briefly I've written. And we are in a postgraduate exam. It's not an undergraduate exam. So as a postgraduate, you should know how to fit your answer in the paper and how to make your answer better. So with this, we come to the part of your theory part regarding your paper 2 and paper 3, which has been already described. So once you finish your theory exams, everything, then probably you have written very well in your exam. Then you are preparing for your exams and you are going to prepare your case. So when it comes to case presentation, you know that how to. So as a student, so how to go about your case presentation. So you have to prepare your case properly as the chief component, and you have to mention the extraoral features or to the presenting malocclusion. Following that, you have to brief the intraoral features, especially emphasizing on the overjet and overbite, dental midlines, any spacing, rotations, and most of the times it is found that you have treated the case. You have treated the case, and you fail to mention the key points of your case. Key points of your case. Following that, your radiographic examination, which needs to be done properly, and most of the times you miss your own findings. You have treated the case, you attempted to correct it, you have corrected it, but you, for example, sometimes it can be a locked sevens or locked eight. Sometimes it can be a rotated premolar, impacted tooth, extra. Because we will tell it's an exam tension. No, exam tension is there. It's there for everyone. It's there for everyone. But you should make sure that it's your own case. You have treated the case. So you should be very clear. And this case has been there from past 3 years, 2 years is there in your hands. Every month you have seen that case. So you can't end up making some blunder mistake in your case presentation. So following that, you have suggested your treatment plan. So your treatment plan is non-extraction using O2 to start MBT prescription. You're going to use transpetal arch and 3D lingual arch placed to reinforce the anchorage, and a composite buildup of lateral analysis, bolt analysis revealed a manual anterior excess of 3 mm. Now, you suggested a treatment plan. During the course of the treatment, you have deviated. That means you are contradicting your own treatment plan. So always make sure that when there is a change of plan, additional discussion should be mentioned in the case file or during the presentation that during the course of the treatment, we came across such a certain condition, hence we changed our treatment plan. So we started with an upper and lower arch, 1/6 nita wire, segmental aligning and leveling. So why segmental aligning and leveling? Why segmental aligning and leveling? Because anchorage is not critical in this case, and the canines are severely rotated, and one of the canine is in crossbite. So it's not a good idea to write at this point of time for us to intervene. So better to start with the segmental aligning and leveling, bring about minor tooth corrections, because we know that during the anchorage loss is very high during the first stage of your comprehensive fixed orthodontic treatment because of the incorporated tip, and we know that the tip gets expressed, so it drags the posterior anchorage. So we give bend backs, we put lace backs. So there are different methods of conserving anchorage. But in this case, we utilized TPA and 3D lingual arch in this case as an anchorage measures. And we know that this case is a very borderline case, and we have planned for non-extraction. So any deviations in our alignment and leveling, probably we can end up this case in extraction. So to de-rotate the premolars, it's always better that if you have couple mechanics, it is more efficient than a free component of force because they can be uncontrolled tipping. When you have a couple acting, what happens is the moment which is generated by these couples are such that it's the center of rotation will be at center of resistance. So we have a more of an axial rotation of the premolar area. So that means we need to have the center of rotation at the center of resistance. So bring about using so correction of the premolar that aids in gaining some space. Following that, utilize that space. Then we have to go for continuous arch mechanics, then go for upper 725 nita and lower 620 stainless steel. Then we had a 7 which was locked. So we put a brass wire, then following that an elastomeric separator, then a custom spring. So sometimes when you're treating some case, you will have done some innovative way of handling a particular tooth or a segment or your mechanics. So it's always better that you can describe it. You can describe it and mention the significance of that particular method of handling the dentition or the correction of the tooth malposition or about the mechanics. Following that, We proceeded further with an open curl spring and sleeve in relation to 2, 3 to maintain the space, same time create the space. And we have used bite blocks in this case to raise the bite. The bite blocks serve the two purposes here because the bite blocks, we know that we are using reverse curve nighti in the lower arch because need to level the spring. During the course of the treatment, what happens? There can be extrusion of the posteriors, which is well taken care by your posterior bite blocks. At the same time, the posterior bite blocks is also helps in opening the bite to get the canines into the arch. And we have used piggyback wire, and the upper arch is stabilized so that the canines move well into the arch. Following that, we got the canines into the arch and they are quite well placed. And we know that there's amount of bolt and discrepancy. Now, it's a very well known fact because most of the times what happens, you have this kind of space and you'll be trying to close that space and that space is not closing. So it's a very clear indication that your midlines are coinciding, canines are in class 1 with optimal overjet and overbite, and you are having some minor spaces. It's a very clear indication that there's a bolt and discrepancy. And this discrepancy can be managed in different ways. Different ways. You can go for reduction or you can go for addition depending upon the situation. So in this case, we know that they were little microdont, so we planned of going for a composite buildup. So it requires an interdisciplinary. So take a close-up picture of this situation so that it will be you can make it more impressive presentation during your exam. So following composite buildup between 1 2 and 1 3 2 2 and 2 3, quite good composite buildup. The rest margins are quite good, finish is good, the color matching is good, and you are able to restore the canine in proportion, and it fulfills all your golden proportion fibrosis series as such. Then at the end of your exam, when you're presenting, you have to give a critical appraisal of your case. So how are you able to treat this case non-extraction? So we have judicious use of spaces in the upper arch. We planned with segmental aligning and leveling, supported the non-extraction treatment. And the occlusion is the results are going to be quite good stable because there's a good intercuspation of the occlusion and better distribution of forces, and we are going to quite good more contacts of the posteriors. There is an optimal soft tissue balance. Composite buildup and bond retainers are favorable factors in limiting some aspects of relapse. We know that there will be some amount of relapse, but it is very important that you keep a watch on this. Now, you presented this case. So, what are the examiner questions? The examiner start questioning about the management of bolt and discrepancy, which I already covered. Extraction of lower aids, which is very much needed because we know that aids can play a significant role in lower crowding, so it's better. And we know that there's a quite a impressive studies which has done about the rotation of the jaw bases, where significant uprighting of the lower anteriors takes place because of the rotation of the jaw bases. So that means your arch length is going to decrease. So it's better to get your aids extracted. Even during my presentation, I have covered why segmental aligning and leveling, how it makes a difference. Then, what are the different methods of unlocking 2/7? So I have used brass wire, elastomeric separator, and a custom-made spring. I didn't go for any more interventional type of mechanics, keeping the mechanics very simple because the 2/7 was easily tipped. So it needed just a destabilizing force and an extrusive component, probably that could have, and we were able to get it into the alignment. And interproximal reduction to be justified if you have done. So you have to, sometimes the question can be, what is the significance of mechanics in handling this case? So why you went for a hand wire, why you went for NITA wire, why that kind of derotation mechanics? So that means you have to support with the current perspective literature and quite a good amount of studies which has been done, that how that in a case of a hand wire when it is used, then how the reverse curve NITA wire, how it is significant, why not other methods? You could have gone for an intrusion mechanics by using an utility arch or an intrusion utility arch or a TAT supported mechanics. But TAT supported mechanics, we didn't go for TAT supported mechanics because this case was not so severe that it requires an intervention, because a TAT is any such that it is going to be an intervention. That means you are going to poke the bone. So it should be, you should need to justify your modality of treatment, mechanics, sequence, archware change. Then at the end, finally, why fixed lingual retainers? Why not? Because you know that there's quite a good amount of literature that lingual retainers lead to a significant amount of bone loss, especially in the lower anteriors, because of the inefficiency in the cleansing method. So commonly, these are the questions that can come when you present a case of this magnitude. So coming to record maintenance. So we know that we have your own case, so it's very well that you always keep your cases documented properly, enter the data, so that it's always good that, because at any point of time you can reference. Now the question comes that is this your own case or you're showing somebody's case? So the integrity of the student pertaining to handling the cases is, so it's my own case because I have the all the data pertaining to what I have done. It is well documented, and you have all the pertaining slips, payment receipts, and case transfer, photograph entry, and sequence of treatment that is done in this particular case, which is well uh, maintained, documented, and kept in the department file section. So following this, when you have prepared a case, when you finished a case of this magnitude, probably that case gets ready for your exams. So when you come to the exam, so you are going to, there are different ways, there are different ways of presenting the cases. So in our department, we have a template method where the candidate has to present the case, which it's not a PowerPoint, it's in a photographic sheet. So where, sorry, where the candidate starts presenting first a brief synopsis of the case. Following that, the malocclusion, the kind of treatment, then use the sequence of the treatment pertaining to upper arch aligning, lower arch aligning, leveling of the arches, then consolidation of the spaces, closure of the spaces, finishing and detailing, settling of the occlusion, and evaluation of the case in relation to macro, micro, and mini aesthetics, and the radiographic records supporting the treatment. Following that, a composite analysis to show the overall changes that has taken here with the treatment. At the same time, superimposition, and well, good finished models. This is not only to impress your examiners or impress anybody. It is your case. You prepare your cases, keep the data like the documentation cases. Probably as a postgraduate, you might be starting about 25 to 30 cases. If you're able to finish 10 cases of this magnitude, within no time, your department can have about quite a good amount of data. And this data will serve your department in showcasing the work. At the same time, these documented cases can be used for elsewhere for your board exams or presentations or to accomplish your additional qualifications. So sometimes special case records require other additional data in the form of CBCT or utilization of CAD CAM, or those documentation needs to be preserved because sometimes the examiners do demand the data pertaining to your CBCT or utilization of CAD CAM. So I sees what mind knows, to be very careful when fabricating appliance for the patients. Now, do not do the mistake what you made in preclinical. So you have been 3 years, you have been managing your the department. So you should not do the mistake what you made in the preclinical. So during your exam, so make sure that you don't see every student is bound to do mistake. Every teacher is also bound to do mistake. But mistakes do happen, but you need to know that that should not happen at the peak at the right time. So your 3 years of sweat in your department is equal to 30 years of your sweet practice. Work discipline, work ethics is very important, especially during your exam time, because you train your fingers within your brain because it saves your chairside time. It's always better that you have not worked for 3 years and during the exam time you will have to struggle and nobody will there to help you. So whatever it is there, you still have a good amount of time for you to improve your work or improve your knowledge or prepare, because a lot of orientation programs have been conducted from the Indian Orthodontic Society. Utilize these programs. They're very good programs, and you can even attend some workshops where you can improve your skills. Self-evaluation. I think Punit sir was mentioning. So we do have a self-evaluation during final exam. So there's we have a curriculum book where the student has to present this. So basic topic discussion, Seminars, journal club, literature review, chapter revision, problem-based learning, clinical audits, CD programs, hands-on workshop, interdisciplinary clinical meetings, conference, conventions, paper presentation, post-table clinic. So all this is all documented and it is presented during the exam. Because sometimes it can so happen that a good student, due to some other reason, he might not be able to perform very well. So this data will help in managing such an embarrassing situation where, for that matter, every teacher wants a student to shine. There is no such teacher that, oh, no, this student should not shine, this student learn. No, it's not like that. Every student wants their student to shine. Every department wants their students to perform better, and every department wants to be excel in their field. So when that is the situation, so dear students, utilize your teachers. They are there to guide you. Use them. Take the help of the teachers. They're here to guide you, and don't lose your focus. So the take-home message for today's topic or presentation is to master your core concepts and classic techniques, demonstrate awareness of new technologies and evidence, practice diagrams and time management, use literature references to stand out, stay updated and confident. Critical thinking is rewarded. Time is your greatest ally. It can be a friend or it can be a foe during your exam. Manage it well to address every question and showcase your full potential. Don't waste time. Tomorrow never comes and today never dies. Okay, so don't postpone your work that tomorrow I will look into it, tomorrow I will prepare it. No, we have some holidays. No, it doesn't work on because time lost is lost. With this, I come to end of my presentation. The rich academic and clinical life also in my department is possible because of my teachers, colleagues, residents, and graduating students. To all of you, my grateful thanks. And other than that, even I've learned a lot. I'm still in the process of learning. Learning is a never-ending story. So love learning because learning is equal to earning. So if you don't love your learning, you will not earn. So whenever you attend any of the presentation, any courses anywhere, you always make sure that you look into the presentation skills of that speaker, the content of his topic, the presentation, the photographs, the orientation of the slides, the text, the flow. This all will make you better in your future. I sincerely thank the Indian Orthodontic Society, Mangalore Orthodontic Study Group, Academic Council of IOS, and Manipal College of Dental Science, Manipal. So, MCODS. So, sir, respected sir, President sir, Secretary sir, respected chairman, and other my professional colleagues and dear students, I sincerely thank you for giving me an opportunity to speak from the perspective of exams. I thank